Mather from Canon Medical Research USA. At Canon Medical, we see AI as a critical tool in our battle to create imaging solutions that can make people's lives better. What makes Canon unique is our approach that combines a deep knowledge of imaging system physics with world-class data science to create algorithms and outcomes that do better than either could do alone. While value in medical imaging is a combination of cost, risk, speed, and accuracy, there is one key factor that influences all of them, and that's image quality. Improvements in image quality can lead to lower dose, quicker diagnoses, greater diagnostic confidence, faster exams, and even shorter hospital stays. By maximizing the value we extract from our images, we can minimize the costs, risks, and time it takes for our partners to practice informed healthcare and to deliver fast, tailored treatments to every patient. This is why our strategy has always been to focus first on maximizing image quality using deep learning technology. By training deep convolutional neural networks with vast amounts of data, we can teach them to recognize thousands of imaging features and noise representations that are often too subtle to notice or too complex to try to model analytically. This is the technology that powers our deep learning reconstruction platforms for our modalities. Our advanced intelligent clear IQ engine technology, also known as AiCE, delivers fast and reliable noise reduction while preserving spatial resolution and image texture. Similarly, we can apply deep learning to our rapid KV switching spectral CT. Deep learning reconstruction allows us to maximize the use of automatic exposure control with rapid KV switching while improving the overall image quality using the noise reduction inherent in AiCE. Ultimately, we can construct high-quality spectral images more efficiently using our deep learning spectral reconstruction. Today, I'm pleased to introduce Professor Ohana from Strasbourg University and Professor Dousset from the University of Bordeaux to describe their experience using Canon Medical's AI technology. Also, we'll hear from Professor Tateshi from Tokyo Medical and Dental University to talk about what deep learning can bring to the world of nuclear medicine. Professor Ohana, please go ahead.
Thank you very much for the introduction. As we see, AiCE acts as basically a very high quality denoiser powered by deep learning, which means that we can achieve noise reduction as if we were using MBIR techniques, but only in the fraction of the time. And on this example here, from hybrid iterative reconstruction to MBIR to DLR, this would take 3 minutes. This would take only 30 seconds. And if you look at the image, the noise reduction is the same with DLR, but the appearance of the image is much more natural and much more satisfying than the plasticky effect of MBIR. We have the chance to work with different vendors and different reconstruction algorithms in our department. And with AiCE, we constantly achieve the best image quality. To give you an example, this is an oncologic patient that was followed over the course of the years on different machines. And if we zoom in with AiCE on the prism, we have the most homogeneous parenchyma, we have the most sharpness within the edges, and all this at the lowest dose possible. This has a direct impact in our routine workflow. And just to give you an example, on coronary CTA done in the department, before the installation of AiCE with our Actinium 1 Genesis, and after the installation of AiCE with our Actinium 1 Prism, we were able, without any specific optimization, just by putting on AiCE, to achieve a 36% dose reduction globally in our coronary CTA, while significantly improving our contrast to noise ratio. In spectral CT, DLR also adds another level of optimization because it is also involved within the energy separation of the multi-kV original acquisition, which means that with DLR, we have improved monochromatic images in spectral mode. This is also a follow-up patient in follow-up examination in an oncologic patient. This was done with AiCE. This was done in spectral mode. And you see that you achieve the same image quality. There is no compromise in image quality in spectral. This is maintained even at low keV. You have here the arterial phase in a patient at 70 keV, which is our default, by default, monochromatic level for visualization. And you see that at low keV, 55, even if the noise is increased, it is managed, it is contained, and the image is good. We also have, thanks to DLR in spectral mode, improved Yoden mapping and effective Z, and you can see that the images obtained are relatively smooth and relatively noiseless. This leads to improved quantification and improved spectral curve. And you see here, if we do a quantification of the enhancement within this mass, we see that the spectral curve is extremely smooth, and then the standard deviation is contained even at very, very low keV. So to conclude on this brief overview, we can say that deep learning reconstruction can be considered, and it's my personal opinion, as the gold standard in CT. We obtain the best image quality. This is obtained with good performance, very fast image reconstruction, and all this at the lowest dose achievable. Thank you very much.
I'm very happy to introduce you the welcome pack examination that we have been working with Canon on our 3T device in the University of Bordeaux in order to obtain a standardized brain fast imaging examination. So here is a welcome pack that we have been doing in 4 minutes and 55 seconds. You can see here a T1 weighted image obtained in 20 seconds, T2 star in 36 seconds, T2 fat sat for the whole brain in 33 seconds, diffusion imaging in 28 seconds, and a 3D FLAIR obtained in 100 seconds, including also time of flight of the circle of Willis in 59 seconds. Thanks to AiCE, we could improve the image quality by denoising the image using artificial intelligence. Let me give you this example of a patient with multiple sclerosis. This is obtained with a 3D FLAIR on a standard image in 4 minutes and 54 seconds. You can see that using AiCE, we improve a lot the quality of the image. But when we acquire the same patient with 3D FLAIR in 1 minute and 40 seconds, we have a reduce of quality of the image. But thanks to AiCE, we obtain an image that is comparable to the one obtained in 4 minutes and 54 seconds by reducing the noise in the background of the image. Here you can see that with using AiCE, there is no anatomical landmark that are removed in comparison to the traditional filter that are used in all the devices of MR that are removing the anatomical landmark. So AiCE is very efficient. We did this welcome pack in less than 5 minutes. And with Canon, this year, we are introducing the 3D welcome pack that we obtain in 6 minutes. So what is a 3D welcome pack? Instead of 2D, we have a 3D T1 weighted image, of course, a 3D FLAIR obtained in 100 seconds, the 3D T2 weighted image of the brain in FATSAT, diffusion, T2 star, and time of flight of the circle of Willis. Total time, 6 minutes and 21 seconds, including the locator. Here, an important issue is a reformation. Here is an acquired image. When we reformat, we obtain an image that has a lower quality than the original image usually. Thanks to AiCE, with the improvement of the acquired image using artificial intelligence, when we do the reformation, the coronal and the axial image have a strong improvement to the comparison without AiCE. Here's an example of 3D FLAIR, diffusion, 3D T2, T2 star in a brain tumor obtained in 3 minutes and 10 seconds and improve with AiCE. AiCE can be also applied for high resolution imaging. I show you here the raw image obtained on the hippocampus in around 10 minutes. And when we want to focus on the hippocampus, we use AiCE in order to increase the quality of the anatomical landmarks of the hippocampus. It can be also done for some areas of the brain where usually we don't have the quality of the image at this level. For an example, here, the thalamus, this is a raw image. And when we apply AiCE, you can see that we can do the parcellization of the several nuclei of the thalamus. I would like to thank, of course, all the people from Canon that have been working. There are more than those on the photo, but of course, I'm happy to show you our device 3T in Bordeaux. Thank you.
Digital PET-CT coordination prime was introduced at RSNA last year. This year, we introduced deep learning reconstruction method for digital PET-CT. This slide shows digital PET images of normal volunteer. DLR shows highest image quality and minimal noises. Better delineation of small lesion is characteristic of DLR. PET in a patient with pulmonary adenocarcinoma shows intense uptake with maximal 9 mm in the largest diameter. 4 parameters of uptake, SV max, SUL peak, MTV, and TLG also improved. This is a PET in a patient with bronchogenic carcinoma. Baseline scan shows intense uptake in all tumor nodes. The difference of parameters were twice with DLR. These nodes are interlobar node and subcarinal node, often involved in bronchogenic carcinoma. Here is a case with esophageal carcinoma with recurrent nerve palsy. Uptake is identified in left vocal cord. Both reconstruction methods resulted in similar visual assessment. On the other hand, volumetric data of the whole lesions improved significantly. PET in a patient with intrahepatic cholangiocarcinoma. Intense uptake is identified in the mass of the right lobe. Tumor shows inhomogeneous uptake pattern and more clearly visualized by DLR. This is a case of pancreatic carcinoma with intraductal extension. This patient developed subcentimetric metastases to common hepatic artery lymph node, which is clearly identified by DLR. PET in a patient with diffuse large B-cell lymphoma at baseline scan. PET demonstrates intense uptake in affected axial lymph nodes. This patient was diagnosed as having clinical stage 4, high metabolic tumor burden in total MTV or total TLG is estimated by DLR. I reported clinical cases using DLR of digital PET-CT.
Thank you to all the speakers. I hope you found this insightful. I would invite you to watch our other showcase that features our automation platform and AI image analysis, such as AutoStroke. For more information on all of our AI technologies, please come and visit the Canon Medical booth.